First responders face high stress and traumatic situations in the line of duty every day. And those events can take a toll on their mental health. Depression and PTSD are up to 5 times more common in first responders. Business of Health reporter Kylie Valletta tells us how a young company is expanding its focus and footprint to help.
Thanks, Gary. We first told you about ProTeam Tactical Performance in 2019 when the company was founded on a mission that focused on physical health for first responders. Created by former Colts quarterback Jim Sorgi and former St. Louis Cardinal Joey Vandiver, the company uses a professional sports approach to help first responders prevent injuries and rehabilitate. ProTeam Tactical is now adding a mental health component dedicated to first responders. And joining me now to tell us more is Jim Sorgi, not just the former Colts quarterback, but also co-founder of ProTeam Tactical. Welcome back to the show.
Oh, thank you for having me.
So let's talk first, a little refresher. This service that you were founded on focused more on the physical side of things. Give us just a snapshot of that service and tell us a little bit about the success you've been seeing.
Yeah, it's grown exponentially in the last 3.5, 4 years. We've done a really good job of providing that better care to public safety and first responders. You know, they're very much like athletes, and as former athletes, we know the type of care it takes to keep them on duty, get them back to duty as quickly as possible. So what we were able to do is take that model, that athletic model, and bring it to public safety. So we get them from their line of duty injuries, their 9 line of duty injuries, and we rehab them just like professional athletes. We rehab the whole body, and we give them that better care, that specialized care that public safety needs. Because they're athletes, they have the high demand, high stress jobs, physically demanding jobs, and they need to be confident that they can do those jobs when they're coming back from an injury.
So let's talk about this new mental health service that you have. It's called SHIELD already. The Fishers Police Department, the Noblesville Police Department have signed on. Explain a little bit about what it is.
Well, you know, we feel like the physical affects the mental affects the physical. And the men and women of public safety, the first responders, they're so used to running into danger while we're all running away. And their exposure to trauma is so significant throughout their careers. It's almost like that it's not a matter of if they're going to suffer from a mental health issue or behavioral health issue, it's a matter of when. So the problem up until this point is it's been very reactive in dealing with these issues. You don't know a problem persists until bam, it hits, and then you got to take care of the issue. And sometimes it's a career-ending issue and a life-ending issue at times. So what we wanted to do was build a platform, a web-based, app-based platform where they can get on and kind of self-appraise where they're at. We feel like if they can do that over the course of the career, throughout the year, they can kind of empty that bucket along the way, and therefore it never gets so full that it overflows. So, you know, we self-appraise anxiety, depression, PTSD, substance abuse, stress, and sleep, because we feel like those are the areas that men and women of public safety are going to have a problem with over the course of their career. Just seeing what they see, and if we can self-appraise them, give them a snapshot of where they're at, and then give them those resources on the platform to reach out anonymously to kind of talk to somebody or deal with that, then hopefully we can stop some of these things and get proactive in their approach instead of reactive.
And these are evidence-based questionnaires, so there really is a lot of science behind this. And I like how the data is also de-identified, and the leaders of the department can kind of get a big picture of how their department is doing as a whole. Right?
Yes, we want to help the individual, but we also want to help the department and show them where their department is at. So the member gets their own login, nobody sees their information or their individual scores, but from the departmental side of things, we can give them the whole aggregate data of their department, and we can give it in different quarters of the year, different times of the year, different holidays, to really show, hey, how much of my department, what percentage is dealing with stress or is dealing with depression, maybe a substance abuse issue, and is there a proactive way we can work with the department on getting information out to the members to mitigate that or help with that along the way. So we feel like it's not only important to help the member, that's the most important part, but let's help the department really kind of identify how their department is doing.
Exactly. I was reading that more than a third of first responders self-report struggling with substance abuse. So you mentioned substance abuse is an issue. I do want to talk about, you've expanded your footprint a little bit. You've been mostly in central Indiana, all in central Indiana, and now you have a new location in Maryville,
yes,
very far north. Tell us why you chose that area.
Very excited about our Maryville location. location. It's a flex space, so it's got rehab, but it also has warehouse space where we can do some job-specific activities. Growth has been exponential. IMPD has their facility, IFD has their facility. We got a facility at Local 416 Union Hall in downtown on Mass Ave, up in Westfield at Grant Park. But how can we expand our reach into a population that has an enormous amount of public safety community? And Maryville was kind of that location. It was a place where we could put a location and not have these men and women have to drive so far to get this specialized care. So very excited about that location. It's kind of open right now softly, and then we got our open house on June 9th, and then hopefully we'll start to see the first responders come through there and get this care for the rehab.
Exactly. Well, we are out of time, but I do want to mention you launched Shield, the mental health product, at the FDIC conference.
Yes,
so congratulations on the
Thank
new
you.
product, and keep us posted.
Thank you very much.